What is snoring? Snoring is the sound produced by vibrations of soft tissues in the upper airway during sleep. It happens when airflow is partially blocked, causing structures like the soft palate, uvula, tonsils, or tongue to vibrate. Snoring is a widespread issue that can affect anyone, causing frustration for millions of Americans dealing with poor sleep. Besides disrupting your own sleep and causing fatigue, snoring can lead to health problems such as difficulty concentrating, irritability, and headaches. Additionally, it can strain relationships, potentially harming the intimacy and even leading to divorce. The impact isn't limited to the snorer, as research indicates that regular exposure to snoring can result in sleep deprivation for partners or spouses, potentially contributing to health issues like high blood pressure. Snoring is a form of upper airway resistance. As air moves through a narrowed airway, it becomes turbulent, leading to the snoring sound. Why do people snore? Causes of snoring, medically proven, include anatomical factors: large tonsils, elongated uvula, thick soft palate, deviated septum or nasal polyps, obesity, where extra fat narrows the airway, and having a small jaw or recessed chin. Sleep position. Sleeping on your back can cause the tongue and soft tissues to collapse backward, narrowing the airway. Nasal congestion or blockage. Allergies, colds, or sinus infections can obstruct airflow. Alcohol and sedatives. These relax throat muscles too much, making obstruction more likely. Age. Muscle tone in the throat decreases as we age, increasing the risk of snoring. Smoking. It increases inflammation and fluid retention in the airway. Sleep deprivation. It leads to deeper, more relaxed sleep, increasing snoring. Is snoring dangerous? Well, it can be. Loud chronic snoring may indicate obstructive sleep apnea, also known as OSA, a serious condition where breathing stops and starts repeatedly during sleep. Signs of OSA include gasping or choking sounds during sleep, pauses in breathing, excessive daytime sleepiness, and morning headaches. If you or someone else notices these signs, it's important to seek a sleep study, known as polysomnography, through a sleep specialist. Scientifically proven treatments for snoring. First, lifestyle modifications. Lose weight if you're overweight. Even a 10% weight reduction can significantly reduce snoring. Avoid alcohol and sedatives before bed. Establish regular sleep patterns. Second, positional therapy. Sleeping on your side can reduce or even eliminate snoring. The tennis ball technique, sewing a ball into the back of a shirt, can train you to stay on your side. Nasal treatments can be incredibly effective for reducing snoring. Nasal strips or dilators help by opening up the nasal passages, which is especially helpful if you're dealing with congestion. Treating allergies with antihistamines or nasal corticosteroids can also make a significant difference. For severe structural blockages, nasal surgery may be necessary. Oral appliances, specifically mandibular advancement devices or MADs, work by repositioning the lower jaw and tongue to keep your airways open. These devices are often recommended by dentists who are trained in sleep medicine. They've been proven to reduce mild to moderate snoring and even sleep apnea. CPAP, or continuous positive airway pressure, is considered the gold standard for treating obstructive sleep apnea. It delivers air pressure through a mask to keep your airways open, and it may even eliminate snoring entirely in people with OSA. For severe cases, there are surgical options available. Uvulopalato-pharyngoplasty, or UPPP, removes excess tissue from the throat. Septoplasty corrects a deviated septum. There are also minimally invasive options like radiofrequency ablation or laser-assisted uvuloplasty, which tighten tissue. Hypoglossal nerve stimulation is another option for sleep apnea. It involves a device implanted in the chest to stimulate the nerves. When it comes to preventing snoring, there are several scientifically backed methods you can try. Maintaining a healthy weight is crucial. Avoiding alcohol 3 to 4 hours before bed can also help. Treating nasal and sinus issues is important, and quitting smoking can make a big difference. Regular exercise improves muscle tone, including in the throat muscles. Practicing good sleep hygiene, like having a consistent bedtime and avoiding heavy meals before sleep, is also beneficial. Using a humidifier if the air is dry can reduce nasal irritation. Let's tackle a couple of common myths about snoring. Myth: snoring is harmless. Truth: it can actually be a warning sign of sleep apnea or other serious issues. Myth: Only older people snore. Truth. Anyone can snore, even kids, especially if they have enlarged tonsils or adenoids.